So just to introduce myself, my name's Jo Blake. I'm a trustee. I'm one of the volunteer team at Greyhound Health Initiative over here in the British Isles. Still letting people in, bear with me. I can multitask, honest. It's a bit like being on time for me. It's quite tough. Yeah, so we've got our first slide recorded kindly by Mandy, our President and Executive Director. So she's recorded the introduction as well as an introduction to the charity, and then we can hand over to Rachel. So we'll just go through these slides, bear with me, and then we'll get cracking.
Hello, everyone, and welcome to our webinar. I'm Mandy Albert, the President and Executive Director of the Greyhound Health Initiative. Today, our webinar will be focused on Sighthound Behavior with Rachel Jackson of Well Balanced Animals. Rachel will be exploring a number of Sighthound behavior topic areas with a particular focus on some of the physical issues that retired racing greyhounds can experience when they have finished racing and as they age. These issues are often relevant to other Sighthound breeds and crossbreeds, originating from old injuries resulting from high-speed racing and chasing. Rachel will discuss how these might affect and challenge our Sighthounds and how they often respond to them affecting their behavior as they age.
So next up, we've got Mandy back with an introduction to the Greyhound Health Initiative for anyone who's not come across us before. I'll give a little bit of introduction and background to Rachel Jackson's experience. Let Rachel speak, and then we'll have a quick summary of what we've talked about and have opportunity then for that live Q&A session. Okay, so handing back to Mandy.
For those of you who are not aware, the Greyhound Health Initiative is a nonprofit organization that is committed to improving the health and well-being of sighthounds around the world. We build awareness of their unusual medical characteristics within the veterinary and adoption communities through our education, outreach, and research programs. This webinar is part of those programs. If you would like further information on our educational resources, please visit our website, ghi.vet, and click on Educational Resources. You can filter the options to the specific resource you are interested in and then browse through the articles and videos. You can also follow us on Facebook and Instagram for the latest educational information and/or future events.
So coming on to Rachel then, there's a lot of copy on here. That's because Rachel has huge amounts of experience. So Rachel is university qualified. She's a veterinary physiotherapist, qualified to work on both large and small animals. She's a member of the Animal Health Professions Register and the Institute for Registered Veterinary and Animal Physiotherapists here in the UK. And she's also qualified as a hydrotherapist as well. So she's got lots of background when it comes to physical therapies and rehabilitation, and a fantastic link between the physical side of things and also kind of behavioural and emotional responses to situations as well. She's a Tellington T-Touch training instructor, which is quite a mouthful. She works with companion animals, and she's also a practitioner for equines in the UK as well. In fact, correct me if I'm wrong, Rachel, I think you're one of only 2 training instructors in the UK, is that right?
There's 3 of us.
Okay, 3. Okay.
Yeah.
So Rachel works, not a vast number. No. Rachel works with clients on a one-to-one basis, as well as training new practitioners as well. So in terms of her dog training experience, she has worked with the fantastic Sheila Harper Canine Centre. And if you haven't heard of Sheila Harper and the way that she works with dogs, I would thoroughly recommend you look her up, because she's absolutely amazing, works really, really well, very much with dogs, reading dogs, working with their emotions, just amazing way of working. And like many of us, she is utterly obsessed, I should say Rachel is utterly obsessed with continued professional development, and has worked with lots of fantastic people, including, I'm going to say this wrong, but Thierry Rugas, is that how it's pronounced? Rugas? Rugas, thank you. Yeah. Dr. Susan Friedman, Chirag Patel, Caroline Ingraham, Melina De Martini, Victoria Stillwell, Linda Tellington-Jones, of course, with the T-Touch, and many more besides. So I'm going to stop sharing my screen now so that Rachel can share hers, and then we'll go from there.
Thank you. So thank you very much for having me here. Apologies for my voice today. I have had COVID, And I think I've had every single possible symptom, including no voice. So excuse me, I may need to take some water and sort of do a little bit of, I will try and mute myself. So thank you so much for the Greyhound Health Initiative for inviting me. I do have my dual head, my veterinary physiotherapy and my Tellington T-Touch. I am an absolute Sighthound junkie. The picture here is me with one of our dogs, Amaya, who is a tripod greyhound, who came to me post-surgery because the rescue didn't want her in kennels, obviously just having had surgery. And I could do the rehab. So she came and, funnily enough, never left. What was interesting to me is I've been a Tellington T-Touch practitioner for 22 years now. And it's a beautiful way of working with any animal, but particularly for our sensitive sighthounds. And I went back to university for physiotherapy because so many of the dogs that I was seeing, there were physical as well as emotional issues going on for the animal, excuse me, at the time. So I wanted a dual way of being able to help them. So that's just a little bit about me. So, sighthounds, what can we say? They're really not like other dogs in so many ways. And we all know they're special, don't we? You know, they are unique, but they're unique in many different ways. And some of you may be aware of this, that they do have physiological, hematological, and cardiovascular differences to other breeds, as well as the fact that their, excuse me, their backgrounds may be very different, particularly if it's a greyhound that's come from racing, but any sighthound. So one of the physiological differences that is worth being aware of, and this is whether it's you've got a full greyhound or a cross, so lurchers in the UK are quite well known, maybe not in the country that you're in. The type of muscle fibres that they have, particularly in their legs, lurchers, greyhounds will have more of the fast twitch type muscle fibres because they're built for speed, not the stamina. Whereas a dog like an Alaskan Malamute that's been bred to pull sleds to go all day has much more of the slow twitch, the type 1 aerobic fibres. And this has been known for a while. As you can see, this study that's listed here was 1990. They were looking at the fibres predominantly in the legs. But this is just one of those differences as to why our wonderful sighthounds have that speed, but not that stamina. And courtesy of Greyhound Health Initiative, do keep a copy of this. A lot of vets are a lot more savvy these days on the differences with greyhounds, but if you move areas, your vet may not be as well aware of that. So our greyhounds and some of our crosses have this unique hematology. They have the higher PCV, which is the packed cell volume. So a PCV, for example, of 40% means that there are 40 millilitres of cells in 100 millilitres of blood. The red blood cells, they have lower white blood counts, the neutrophils, the platelets. Just looking down this list, you can see how they vary from other breeds. They have a unique biochemistry as well. So they have higher creatinine, which is a waste product that's made by your muscles as part of regular everyday activity. So normally kidneys filter this from your blood and send it out of the body in your urine. So it's important that our vets know these differences, because they may look at these results and go, gosh, these are outside of normal, but actually they're normal for our sighthounds, particularly our greyhounds. Also, lower total T4 and free T4 results. So if, for example, you've got a dog whose behavior may be changed and the vet suggests that they do a T4, they're checking for the thyroid, actually they will come back lower typically than for other breeds. And that's just them. It does not mean that there is an issue with them. So ask your vet to check the TSH levels and discuss the clinical signs as well before accepting a diagnosis of hypothyroidism. The heart as well. So large heart with left ventricular hypertrophy is normal for the breed. They also may show mild heart murmurs as common, and these are not necessarily going to cause them a problem. So when we look at our sighthounds as a breed, as a type, there are these things that will come up when they go to the vets. So it is always also worth you having a good sort of normal benchmark, a baseline. So rather than your dog first having bloods done when they're poorly, actually have a normal baseline blood test done for them, so that you know what their normal is, so that if things are changing for them physically or behaviorally, that actually you've got that to compare it to, because otherwise it can be really difficult to be able to tell as well. There's a few other things that our lovely sighthounds can be a little bit more prone to. And one of these is dental disease. Remains an issue within sighthounds, and that can be whether you clean them, whether you're really careful. Some greys in particular do have that poorer dentistry, but the more we can do to keep them clean and keep an eye on the teeth, deal with problems sooner rather than later before it becomes a bigger issue for them. Osteosarcoma is a major issue for the longer-legged breeds. So if you see an intermittent or an unexplained limp, seems to come and go, there's nothing in particular that you notice that can have caused it, please do get it checked, because there are ways that, you know, it could be treated, it could be dealt with, depending on where the osteosarcoma, where the tumour is. Osteoarthritis. So osteoarthritis is a problem for many breeds, but we do have a high prevalence within sighthounds as well. Any damage to a joint or instability will lead to degenerative joint disease in a joint. So it may be that they have the osteoarthritis in one specific joint because it was damaged at some point, or you also get dogs where the osteoarthritis is in many joints and they may have generalized osteoarthritis. But again, get it checked, because there are things that we can do to help our dogs with this. And the dreaded corns. So lesions on the pads that lead to pain and lameness. Dogs do not limp unless there is a reason. And, you know, if any of you have had a verruca and you've walked on a harder surface, then you'll know how uncomfortable and painful that can be. So if you've got a lameness, make sure that the pads get checked as well. It's easy sometimes to forget the foot, but have them really carefully checked that there's no corns there. and I hope you made the talk, I think it was about a month ago, with Richard Doty, which was amazing, looking at corns and sort of the possible treatments. We've got the flexor tendinectomy, which is now accepted best treatment for corns and is performed quite routinely in the UK, both in vet schools, but also in veterinary practices and similarly around the world. And this is one way that actually the corns can be gotten rid of permanently, because if they're holed, they frequently come back. I also wanted to mention this, greyhound bleeding syndrome. Now this, although there were 3 research papers that came up with this, the research was carried out predominantly on retired racing greyhounds undergoing neutering or limb amputations. But this is not the only time that you will get greyhound bleeding syndrome. Now, 3 research papers have come up with that about a quarter of greyhounds can suffer from increased bleeding or bruising after surgical procedures. So the surgery goes well, there's no sign of bruising or bleeding initially, but it comes on over the next few days. And this is compared to about 2% in other breeds. So this is quite a big issue for our greyhounds. It's also been noted in other sighthound breeds, predominantly deerhounds and Irish wolfhounds. So it isn't, again, just the greyhounds. So it occurs when the body forms a clot as normal, but then other chemicals in the bloodstream dissolve the clot too early, so the bleeding starts again. So you get this bruising, and it can spread. Now, there is quite recently a new genetic test available to assess if a dog is prone to this syndrome. But there is also the option of giving an antifibrinolytic medication, which can reduce the risk of this happening. So in the UK, it's tranexamic acid, and it's given either at the time of surgery or dental procedure, because it can happen with dentistry as well. So if a tooth is removed, it may clot, but then it starts to bleed again, and the bleeding just doesn't stop. And the medication stops the blood clots from breaking down too soon, and it doesn't have too many side effects. In the States, they use something that's called Amicar instead. It's useful to know about this because this can be a really serious problem. So even if your dog has had what is classed as a routine surgery, keep an eye out for either excessive bleeding or bruising, and they need to go straight back to the vets. It needs dealing with. So please be aware of that. And we have our wonderful dog's skeleton. Our dogs that are so flexible, can move around so freely, can turn, but unfortunately, sometimes that can also cause them problems. So your sighthound has approximately 700 muscles and about 320 bones. That does depend on the length of the tail, but that's roughly how many bones our dogs have in the body. Now, the muscles attach to the bones by a tendon. So you've got the muscle, then the tendon that attaches to the bone. And they act as pulleys, and the bones are the levers. So when the muscles contract or shorten, they flex the joint and the movement happens. And then they've got an antagonistic muscle, which moves at the opposite time to straighten a joint as well. Now, muscle injuries are quite common, and these can lead to scar tissue. Now, scar tissue is great because it's really fibrous, it's really strong, but it isn't as flexible as the muscle itself. And strains are a really common injury. Most muscular injuries occur at the muscular tendinous junction and where the muscle inserts onto a bone. So these strains, which are commonly known as tears or torn muscles, excuse me, they will mend given time, but these muscle fibers don't knit together smoothly the way they were before, so they all function in a long line. They're made up of different types of collagen, and this will get a little bit knotted and will shorten the muscle. So this increases the risk of re-injury and also reduces the range of motion. And what we mean by range of motion is how much flexion and extension they've got through each of the limbs. And this can also be sort of as they move their body as well, so that flexion through the back. And this will affect their gait, so it will affect how they move. And it may be that if it's one leg in particular that they've tended to injure, you may see that the stride on that particular leg is shorter than the leg on the opposite side. So we've got a number of, like we said, a lot of muscles in the body, but we've got some really big muscles. The biceps femoris muscle, which comes around here, that's that really big chunky muscle. The gluteal muscle, oops, it's getting a bit keen, which is one of our hip flexors, so really important in that reach through. The latissimus dorsi, which is a muscle that draws the front leg back, but is really important. It's quite a flat muscle. So having some knowledge of some of these muscles can be really helpful, because there are some that they tend to injure more than others. So, excuse me, we've now got hail, if you can hear the noise. So because our wonderful sighthounds love to run round, they are prone to certain injuries. So when they accelerate, that zero, that shooting off, this is often when they will injure a hind limb. So the tarsus and the hock, they may get fractures, they get strains. These things are typical of that acceleration. If they're racers, they may be more likely to do different type of damage on the bends, but this is the same as our sighthounds as they go round corners. You know, they may go off in a straight line, but then do that really big loop. Again, on the bends, they're likely to damage the hind limb, the forelimb, the carpal, so the wrist, highly likely to get injuries there. And they're also very prone to stress fractures. They also get micro tears within the muscles. So this is when the muscles get that little bit of damage, then that little bit more, then that little bit more that build up. Because the thing about sighthounds and our racing greyhounds, they don't slow down on the bend. But this increases the forces through all the legs. So they are more likely to get injured as they take these corners because of the forces of as they turn. When they stop suddenly, this is often when they'll injure the forelimbs. Carpal injuries, so I mentioned that's the wrist. They're prone to getting accessory carpal bone fractures. Ligament damage is present virtually in all carpal injuries. So that won't show up on X-ray, but they are very prone to ligament damage if there's carpal injuries. Also, the triceps brachii muscle, which is one of the forelimb muscles, usually the long head. Shoulder injuries are responsible for about 16% of withdrawals during racing, and the majorities of these are tricep injuries. So if your dog's possibly an ex-racer and you know it's had shoulder damage, get the triceps muscles checked, because that may be where the original injury is coming from. The other thing that also happens is any time that there's been previous injury, we may get scarring, we may get a repair, but we may not get that even collagen, those muscle fibers being in a line again. So because of this, if they've had a previous injury, they may well get a subsequent injury at the same spot as well. The gracilis muscle, very prone to strain. This commonly tears when they go from a standing start. So it's when they go that immediate takeoff. And again, this isn't just our greyhounds. It's that explosive movement when they set off without being warmed up. So if you've got sighthounds and you decide to, for example, hire a secure field if they don't normally go off lead, it's a really good idea to give them the chance to warm up first before they go, because that could be a time when they actually damage the muscle. So all of this area, this is the back of the hind leg. This is gracilis damage, sometimes referred to as drop or back muscle, because it's the back of the back leg. But fresh strains are often seen as the bulging muscle, so you get a real bulging of the muscle, and it may be tender to touch, it may be bruised, may feel hot and swollen. So repetitive strains here lead to gracilis myopathy, and this is where the dog will often throw out its hock and have a shortened stride and have a bit of a jerky movement when the leg's actually raised off the ground. So again, just be aware that this is one of those injuries that can happen quite commonly. Now, when we're also looking at our dogs, we're looking for a degree of symmetry. So this picture managed to get Idris with all 4 feet off the ground, just having a run in the park. Now, muscle atrophy is a wasting away of muscles. And this can happen for a number of different reasons. So if you've got joint pain, they're not going to be using the limb as much. The muscles will start to waste away, and this will happen really quickly. Within a week, you can easily see the beginning of muscle atrophy. Arthritis, osteoarthritis, again, will lead to muscle atrophy, and other chronic conditions as well. Reduced activity, so whether that's from your dog aging, although there is an issue, as dogs age, they get something called sarcopenia, which is where the muscles actually start to lose that form, or injury as well. So you may see that one side remains the same, if we think of the hind limb, and the other side just hasn't got that curve in the muscles as well. Reduction in growth hormones that causes your dog to be less able to process protein, again, is typical in aging dogs. This is often where you will see more general muscle atrophy. Some medications, but some illnesses and diseases will as well. Some myositis, which is generally caused by an injury. Excuse me, but infections can cause this as well. Autoimmune disease will change muscle tone. Degenerative myelopathy, which is now referred to as DM, which is a disease that progresses and affects the dog's spinal cord and limbs. So starts with the hind limbs and slowly works forward as well. So muscle atrophy may not be symmetrical. So have a look at them, for example, from the rear, and look to see if their muscles look similar or if one looks a little bit flatter. Take pictures, because it's often easier than actually expecting our dogs to stand still to actually take a picture. So take one from each side, level with the dog, from the back and from the other side, and see how they're going to be able to stand. You know, do they stand with a leg at each corner? I've already mentioned that any unstable joint, whether it's due to injury or surgery, will affect that joint and will at some point suffer from DJD, typically osteoarthritis, which will affect the mobility, it will affect how they move, but it will also affect the behavior as well. So being aware that physical affects behavior is a really important aspect for our dogs, because they are prone to injuries. They are prone to injuries in different places. This is going to affect how their behavior is. So changes in behavior, please be aware of that. Now, talking about behavior, just wanted to mention sleep startle. So this is one of my lovelies. He was a lurcher, he was a mix. He had sleep startle for a few years, actually. If you think about it, sleep startle, if you've ever woken up from a deep sleep, you have no idea where you are for a second, that feeling of sort of that unaware, that little bit of a feeling of being confused, a bit of panic, a little bit scared. Well, this can also happen to our sighthounds, and it isn't just sighthounds that suffer with sleep startle, but it's something that comes up quite regularly when I'm working with clients, that their dogs do suffer with sleep startle, which is why I wanted to mention it. And it can occur when your dog is woken abruptly from their sleep. It might be if they sleep on the settee next to you, you move, and that startles them. And you get this big response, because they can be really deep sleepers, but they can also sleep with their eyes open. So it might actually look like they're resting, but they are actually asleep. There are ways that you can reduce the chances of this happening. So ensuring that they hear you approaching, certainly before you make any contact with them, because it's not uncommon for resting dogs to grumble or to maybe air snap when woken suddenly, even if it's just you moving next to them. And that used to happen with Kai. He'd lie down on the settee, he'd fall asleep and just move a little bit, and we'd get that really big startle response. And it happens more commonly if your dog's newly adopted, maybe hasn't settled into the full routine yet, maybe not yet formed that great trust, that feeling of safety. And often the more relaxed and less anxious they become, the less often that it happens. Because it's at a real subconscious level, they feel they need to be on alert. Excuse me. And it's often as they're making adjustments to a home life. And although it may be common in greyhounds, it does happen with other sighthounds. I've had 2 lurchers and 1 greyhound that I live with. Both have sleep startle, but actually then it starts to ease. And a lot of times it's scary for people. You know, people say, oh, you know, my dog's terrible. He growled at me. He air snapped at me. But it's merely instinct. It's that feeling that they feel under threat. The underlying most basic thing that our animals and us need, the bottom, the big bit of our pyramid, is to feel safe. And sometimes when they don't feel safe, that's when we have examples of sleep startle. And it's not their personality, it's not them, It's that immediate panic response. So, you know, there's sometimes reasons we have sayings, and one of those is let sleeping dogs lie. You know, give them somewhere safe to settle, give them that space, give them that time to actually wake up, maybe use their name, maybe moving around the room, but not too close, because it is very easy to startle them. Pain. Now we're talking about behavior. Pain is a big issue where behavior is concerned. And I had to throw this one in. The greyhound scream of death. I love Richard Skipworth and his cartoons. Yeah, this greyhound is howling and holding a leg up, and we think, oh no, it's terrible, it's terrible. And oh no, what's wrong? What's it? Your paw? Is it your leg? And oh, you fixed it. But actually, the thing about this is we sometimes make a joke of this, and they can be prone to it, this almighty scream. But actually, often when we get the howl of death, it's not something major. But actually, we can sort of go, oh, we're okay, and they get better. But actually, our dogs are very good at hiding pain. So yes, we talk about the howl of death and that ear-splitting noise that makes you think, oh no, they've severed a limb. But actually, they are very, very good at hiding that pain. And these are just a few ways that our sighthounds could be in pain, but actually we may not be overly aware of it. So infections, and this could be an infection in a wound, but actually it could be something like a urinary tract infection. So keep an eye out for changes in behavior if they're starting to have accidents around the house when they haven't in the past. Sometimes that can be a urinary tract infection. I had a client once ring me up. This was a physiotherapy client. And I was quite worried because he didn't often ring me, and the dog was a senior, and I'm thinking, oh no, what's happened? And actually the dog just collapsed, and she had a massive, massive infection, but she'd hidden this really well onto the point where they'd gone out for a walk and she just collapsed on the walk. So do be aware that infections can be a really big issue there for our sighthounds. Acute injuries. So thinking about those times when they, for example, jump off the settee and they're holding a leg up, you know, that's an acute injury. And as long as the healing process goes well, these acute injuries do go away. But like us, if we're walking down the street and we go over on our ankles, that can hurt for a few days. And that's the same for our dogs as well. Also, with our lovely sighthounds having the thin skin that they do, you know, wounds are very, very painful. So being aware, actually check them over, because they don't necessarily always yelp, but actually they can have, you know, a really substantial wound and we're not aware of it. I mentioned dental problems already for our sighthounds, but actually it can be a big issue. So look for things like if they're struggling to eat, or maybe they're dropping the food, or maybe excess salivation. You know, I don't know about you, but if I've got toothache, it's really, really debilitating and does come under the chronic category because it's ongoing. So do keep an eye on your dog's dental health as well, because this will all have an effect on the behavior. Muscle strains, which we've already talked about to a degree, actually they can be really debilitating, because not only is it the muscle strain itself, but you've got that compensatory movement that again will have an effect on how they put additional strain on another limb, for example. So to offload one leg, they will often put more weight on another leg, either the diagonal or the leg that's next to it, the contralateral leg. And then you may start to see problems there. Chronic diseases, anything chronic sets up different types of pain. So acute pain and chronic pain are different to each other. And osteoarthritis is prevalent, not just in your seniors either. So please be aware that osteoarthritis can be in young dogs too. Pain following surgical procedures, they can mask this, but actually some of the surgeries that we class as routine for our dogs are actually major surgeries as well. So bearing that in mind. Skin problems, again, comes quite often under the chronic issue. And conformation, you know, there's lots of reasons that our dogs may be in pain. These are just a few. But always be aware that if there is a change in behavior, that actually pain may be the underlying issue, and please get it checked. So if we're thinking about arthritis, a recent study that was undertaken in North America, and this wasn't just in Sighthounds, this was in across breeds, found numbers ranging from 20% in dogs older than 1 year. So that's 1-year-old dogs, up to 20% of them had arthritis, up to 8% in dogs older than 8 years. And this was based on x-rays, because that's how arthritis is commonly diagnosed, and information from vet checks as well. Now, arthritis is something that will come with age, but also a damaged joint is more likely to get arthritis. So you get, as you can see in the picture, the destruction of the cartilage, ligament loosening. So the ligaments don't hold the joint as well. So you may get these altered movements. They may not hold the joint in the direction that they should do. You may get a laxity, and you'll get synovial inflammation. We tend to think as well that actually it's just winter that will affect our dogs, but actually for some dogs, the heat can be more of a problem for them. Most commonly affected joints are the hip, the stifle, so the knee, and the elbow. And arthritis is a painful condition. Speak to any human who has arthritis and they will say how painful it is. But our dogs are really good at hiding this. So a dog with osteoarthritis, you may see typically that it's stiff in the morning after naps. Usually as they start to move and they warm up a little bit, they'll walk a little bit more. Damp, cold weather, so in the UK we're just going into autumn, that can make the condition more painful. So think as well about keeping them dry and wearing coats. You may be used to drying your dog off if they've got wet, but actually they may be sore if you're a little bit, if you tend to rub them with a towel. So actually think about sort of stroking the towel down, because they may be more sensitive to that as well. So with pain, we may actually see behavior changes, and these may be very subtle. It might be a slight change in the comfort levels. It might be a change in their tolerance levels. So a dog that's previously tolerated certain things, whether it's dogs running up to them in the park, whether it's noise sensitivity, activity levels, these may all vary. And chronic pain has an emotional effect as well. So chronic pain may lead to being less willing to engage in social interactions, maybe less interested in play, may actually want to spend time away from the family a little bit more. So they may choose to go and sleep in another room rather than actually staying in the same room. They may show avoidance behaviors, trying to keep distance from something that they feel it may be a risk to them. So we may hear that, you know, somebody describes the dog as grumpy with other dogs when they haven't been before, but also think about what grumpy looks like. Grumpy isn't descriptive. Grumpy works as a label, but actually, what is it we're seeing that we think means that they're grumpy? They may sleep more. If they're used to jumping onto the furniture, they may hesitate first. Same with getting into the car. They may not want to go for a walk, or they may go out for a walk and not want to be out for as long. So some of these changes can be really, really subtle. So being aware of that can really make a difference to our dog's comfort. Now, there's lots, I could talk forever on the possible signs of pain, but let's just have a look at a few of them. So their daily habits. So is there a decrease maybe in their appetite? I've already mentioned, are they withdrawing from social interactions? So they may have always come over to you, maybe wanted a fuss, but actually they're keeping that little bit more distance. Changes in sleeping habits. They may sleep more, or because there's always different extremes. You know, for one dog may do one thing, a dog may do an opposite. They may struggle to settle and sleep, so they may be wandering around a little bit more and pacing. May see changes in their drinking habits. There may be lapses in house training, so you may be getting accidents in the house where you didn't get them previously. So there's a mix of things that might be going on in their day to day that you might go, there's been a change there. Self-mutilation, they may be licking themselves, or they may be biting or nibbling. Now, sometimes that might be the area that's sore, but if they can't reach the area that's actually painful for them, they may actually nibble a front leg, whereas actually the issue's with one of the back legs as well. So be aware of where they're licking or nibbling. You may see that, for example, the fur looks like they've been licking, or you start to get patches where there's a little bit less fur. They may be scratching a particular area of the body, or they may all of a sudden look round at a certain area. It may be that they've got a sudden pain. So being aware of that. Changes in activity level. So again, they may be reluctant to move, but actually they may become restless. They may struggle getting up. So look at the type of bed that they choose to lie in. Did they used to always curl up, but actually they're preferring to lie out flat now? So are they struggling to get up or struggling to lie down? Are they repeatedly getting up and down, up and down? They're not able to settle the same way. Is they're trembling, or are they lying very still but alert? They may not want to go for a walk the way that they used to, or the length of the walk may vary. So activity level can give us quite a clue, as can facial expressions. So you may get enlarged pupils, panting excessively when they're resting, so not just when it's warm, a vacant stare into the distance, glazed or wide-eyed looks, so the whole face can look tight and tense. You may get flattened ears when you've not had this before. Look at the posture. Do they look hunched in the back? So do you get that rounding in the back? Is the hindquarters higher, the front end lower? What's the neck posture like? Are they symmetrical? So do they stand with a leg at each corner? Are they putting the same weight on the front both front limbs, or do you see this little bit of a lean to one side that they're offloading one of the limbs? Now, they do put slightly more weight on the front limbs than the back limbs, but is it excessive? Coat changes. Now, this is something that we've spoken about for a very long time in T-Touch. Are there any changes in the coat? So does it not look as glossy as usual? Have they lost some of that shine? Any changes in direction of the coat? Is it standing up in some places? Are there areas where it looks greasier or dry? Are they molting a lot? Some dogs, you don't see much in the way of stress response, but all of a sudden they start to blow the coat, and you stroke them from head to tail and there's a pile of fur near the tail. That can actually be a stress response. And also reactivity. So sometimes this is the one that as humans we tend to notice because it's noisy and scary. But actually there may have been previous quieter signs that we've just not been aware of. So looking at, are they acting out of character? Are they less tolerant of other dogs? Are they lunging on the lead or barking? Often it's the vocalizations that as humans we're more aware of because we're more of an auditory being. So sometimes this is where we actually start to notice, but actually there may have been more subtle signs that have been there before then. So being aware of that and then being able to do something about it. So chronic pain. Now, the emotion of pain is a form of fear anxiety. So we may see, excuse me, changes in how comfortable they are. They may be more concerned in different situations. So you may get inhibition. And I've mentioned this already. This is when they go away from things. They want to move away. But they may be looking at things, excuse me, and taking things in. And they may look quiet. And they may, excuse me, look like they're relaxed, but actually they're not. And they may also go and sniff and lick at people. But actually, this may be misinterpretation as affection, but it may be a way of getting that emotional contact. Anything that the animal perceives to be a risk in terms of inducing pain can lead to a response such as, might be a low grumble, they may go very still, you may get a growl or an air snap. These are ways that our dogs are trying to keep that threat away. So you may get a dog who may have normally greeted other dogs when they're out and about calmly, but actually you see them start to stiffen, they want to keep away. So the other thing that can happen in addition to this direct effect on behavior is it has an effect on the emotional capacity. So they're more likely to react to different stimuli. And this can be things such as noise levels as well. So if your dog becomes sound sensitive, whether it's to fireworks, storms, the wind, even noises, for example, in the kitchen, then that may link with chronic pain. There was a study done in 2019 that looked at dogs that had sound sensitivities. They were given a really thorough physical check over, and most of them were found to have some degree of musculoskeletal pain or issues. When that was dealt with, the noise sensitivity went away. So being aware of that as a possible issue is really worth just, if we're aware of it, we can do something about it. If we're not, then we haven't got that knowledge. So please be aware of that as a possibility. So something that we focus a lot on in T-Touch is posture, because it can give us really vital information. So look at how they stand, look at how they sit, how do they lie down? Is it always the same? Do they always turn in the same direction, or do they turn in one direction only? Do they only lie on one side? These can give us clues as to why our dog maybe reacts the way that they do. If we can encourage them to change their posture, this will not only relieve physical discomfort, but also it encourages efficient body and brain engagement. And many of our dogs that react to things, it's not engaging the brain, it's that fear response. Whereas actually, if we can help them change their posture, we can help change their behavior as well. The other thing is that a balanced dog is much less prone to injury. They're less stressed. They're going to learn better and faster. And is behaviorally what we may class as more reliable. So people might say, oh, my dog's unpredictable. There will be some underlying reasons that they're behaving the way that they do. And actually, there may be something that we're missing there as well. But a balanced dog isn't going to be knocking themselves, so they're going to be less prone to injury. That body awareness that's called proprioception. If our dogs have good proprioceptive awareness, again, they're less prone to injury. Patterns of behavior link with tension. So dogs with poor balance tend to be more emotional and possibly more reactive. So if our dogs have tension in their body, an area where maybe we touch them and we get that little bit of tension or that little bit of a skin ripple, or that the skin itself feels tight, these are going to be dogs that are possibly going to be more emotional. But through using T-Touch techniques, actually, we can really help them with this. Now, if we have a dog that we think may be in pain, or we're looking at ways to sort of make their lives easier, do consider how much time that your dog spends inside your and their home. Because the home is where they spend probably the majority of their time. If you can make some simple changes at home, that will make a massive difference to their sense of well-being, but also pain levels. Because if they feel secure, they're more relaxed. They're not going to be holding their body as tense. They're going to be able to move more freely. You're going to get less compensatory issues. So I'm going to run through a few, she says, of the possible ways that you can just look at your home a little bit more from your dog's perspective and see how you can make living in the house easier for them. And the first one is always top of my list, rugs. Because our dogs' pads don't offer much grip to floors. And so many houses these days have laminate flooring, lino, vinyl, or tiled floors. And dogs struggle on these at any age. So it isn't just our seniors. A young dog, if they run through, can actually slip, fall, they can injure themselves. So not only do having rugs help them feel more secure, you are limiting the possibility of them injuring themselves. So imagine your anxiety if you had to walk on ice all the time. Well, particularly for our older dogs, this can be what it's like walking on these more slippery surfaces. So if you think about what happens to us if we're walking on ice, our posture changes. We hold tension in our body. You will go into one of the Fs, probably. You might try and get away from it. You may freeze and think, how am I going to get away from this? Adrenaline and cortisol will be going around in your bodies, which makes for different physiological changes. And the mental anxiety that this can create is absolutely massive, because your dog's worried that they're going to hurt themselves because they're already struggling. They then slip and feel pain, and then create an acute injury on top of the chronic issues if they've already got them. So rugs is always top of my list of things to suggest to people if they have got any of those types of flooring. So they avoid repeated slips, better than having to increase pain medication. Pain medication absolutely has a place, but if we can keep it minimal and avoid the injuries, it is so much better. So these need to be non-slip rugs. So they need either a non-slip backing or some form of grip underneath. And you need a minimum of a walkway around the house for your dog. So watch where they walk. But the other thing to make sure is that they have a turning space as well, so that there's enough rug coverage that as they turn, one leg doesn't go off and just slide out to the side. Put rugs around and under the beds, so when they're getting up and they're stiff, that actually they've got a secure surface. And they don't need to be expensive rugs. Yoga mats are brilliant on many floors to give them that walkway. Gym mats that lock together. Now, you do need to make sure that they cover the full area, because otherwise they may slip on the floor, but they can be a brilliant way of just covering the area. And if you can't modify an area for some reason, restrict access when you're not around, so that they are safe. Stairs. Stairs need an awful lot of coordination. And those of you with greyhounds may find that actually they've not gone up and down the stairs. They require such different skills, that proprioceptive body awareness to do it. And they may look keen because they're fast, but actually it's not that they're keen, they're fast because they haven't got that body coordination, and they're going up and down really, really quickly. So being aware of that, what can you do? Well, you may need to use a baby gate to restrict access. My tripod girl, for example, she can go upstairs, but she can't come downstairs. Now, she's sensible. We did used to put a baby gate at the top of the stairs so that she wouldn't try and come downstairs. We carry her downstairs. But actually, you've got to be aware of your own backs. These dogs are not often lightweight dogs. If they really struggle and they need to be going up and downstairs, if you've got a house that's on different levels, actually a help them up harness can be amazing, or one of the rough wear harnesses that has the handle on the back, they can be really useful for them as well. Ramps, not just for cars, but for getting up and through steps into and out of the home. And with ramps, and for a lot of these things, I would say start sooner rather than later, because the thing for ramps is they need to have that confidence, particularly for a car ramp, and you need them long enough that the angle isn't too steep, depending on the type of car that you have. Make sure that they've got enough that it isn't too steep for them. Just stepping into the house, you know, they can struggle to lift their legs up. This was a homemade ramp that was quite simple for somebody to make. You've got to make sure again that if they're outside that they don't get slippery if they get wet. But actually, even putting these in place is going to protect those joints as they age as well. So ramps, it's important to have them so that they learn to walk along them on the flat, if we just automatically put them up against the car and expect our dogs to walk along them, actually that's a really big ask, particularly if they've already got an injury. So start on the flat and slowly raise them so that actually they get used to walking on them. And also make sure that the ramps are wide enough for your dog and also are sturdy enough to take their weight, because some of the ramps that you can buy these days are designed for smaller dogs. So please make sure that they are secure enough, because your dog's not going to feel comfortable walking on them if they don't feel secure, if it wobbles a little bit. So ramps will be your friend as well. Sleep. Now, an older dog may require more sleep, but it's also important that we think about the fact that they can sleep in peace. So an older dog may be losing the hearing and may be startled if you approach them or touch them when they're asleep. So we mentioned before about sleep startle. Your dog may not have been startled when they're younger. All of a sudden, you're starting to get that response. So they may feel safer and more secure thinking about the bed. Where is it going to be? It needs to be comfy. We want it to have enough padding, but also that there's that little bit of give. Orthopedic beds are great, but don't buy one that's really high that they might struggle to get onto. If they like to stretch out, make sure it's big enough for them. You know, orthopedic beds can be great, but one of the most expensive beds I've ever bought was one of these big orthopedic beds, and none of our dogs lay on it. And we had 6 lurchers at the time. They would only lie on it if we put another bed on top of it. So for them, it was that little bit too firm. So make sure that you look at how they prefer to sleep and think about how that best fits for them. There is no one answer, but make sure it's comfy, make sure it's not in a draft. So get down to that level, particularly this time of year. A lot of dogs like to be in view of the family. So it's not necessarily about moving the bed so that they're way out of the way, but actually, particularly if they're losing their hearing, they may like to be around you as well. So see where they choose to lie and also give them options as well. So usually Sighthound people have more than one bed for their dog. So be aware of where they choose to sleep. What is their favorite type of bed? Do they like a big one? Do they like one where they've got somewhere actually that they can rest their head on, a pillow? So all of these things are important for our dogs because dogs need to sleep. Now, for many years, it's been suggested that we raise bowls because it may limit the dog's propensity to getting bloat. More recent studies have said neither way. But actually, a dog with painful joints, particularly our long-legged sighthounds, will struggle to bend down to eat. And if their bowls are on the floor, actually just look at how they manage that. So look at the posture when they eat. Take a picture of it and actually study it. Do they look comfy? So raising the bowls will help them be in better balance, not put overly excessive weight on the forelimbs, which can happen. But it also stretches the neck, and which will then put additional strain on the back as well. So doesn't have to be expensive or fancy. Look at something you've got already. So it might be something, depending on the size of your dog's bowl, an upturned bucket or a flower pot. Just make sure it's stable. For some dogs, a good height is one of those fold-out footstools that has a non-slip surface. They can be great. But having them so that they sit so that your dog can reach into the bowl without having to reach down too much, but also without having to raise their head too high. Foot care. these toes, these digits can become arthritic, and that can make walking really painful. So they may prefer to walk on a different type of surface. So give them enough options. See, do they prefer to walk on the floor? If it's a hard surface, do they prefer to walk on grass? Keep the nails a short length. Particularly as our dogs age, they may walk less and their claws may actually start to need clipping or grinding. Because if you look at the two illustrations here, you can see how much of an effect the longer nail has on the angles of all the phalanges in the toe up onto the paw. And it will shift the weight backwards. And this again will have a knock-on effect to how they're walking. Now this picture is one of our dog's paws. He gets really excessive fur within his pads. He's a Greyhound Saluki. Trimming that will help aid grip and balance, but also they can get mud in there and it forms balls, and that can become uncomfortable. If it's icy, if there's snow, again, that can get in between the pads and be really uncomfortable as well. Exercise. If you don't use it, you lose it, but has to be a balance. So for our dogs who are maybe a little bit sore, rather than doing one long walk, split it into two. It's easier for them. And if you're noticing that they're stiff after they've had a sleep, then maybe the exercise they're doing is too much for them. But maintaining muscle is important as our dogs age, because I mentioned before the issue of sarcopenia, where they start to lose that muscle tone as well. Another way that we're able to improve this is T-touch groundwork will really benefit your dog, moving slowly through and around over different surfaces, over poles, but make sure that your dog is capable of that. You know, they're physically able to do it. We don't want to over-challenge them. And the mental exercise is so important. Let them sniff. Now, some dogs struggle to sniff when they're out on walks because actually there's so many things going on in their environment that actually they struggle. But they can take up new hobbies, man trailing, so where they're following a scent, pet trailing, doing scent work, something like hoopers. I do hoopers with both our greyhounds. One who had a fracture, the accessory carpal bone, and our other girl who's a tripod, and she loves doing hoopers. If they can't walk in their favourite places anymore, bring the scents home to them. So get an old t-shirt, take it out with you, and wipe it on floor, you know, lampposts, trees, bring twigs home if it's okay to do so, so that actually you can bring the outdoor back to them. And these days, there's so many different enrichment activities that really you are spoilt for choice. Whether it's them finding food around the house, whether it's licky mats, snuffle mats, teaching them something new, because you can always teach an old dog new tricks. So don't believe that saying that you can't. And actually it helps keep them cognitively aware. And it's about being, you know, fair to them, that actually keeping them mentally active. And that can be important if they're used to going to lots of new places as well, and they're not able to do those just distances. And for some of our dogs, actually a good way of making those changes, and something I suggest quite a lot to my senior dog clients, is the use of a stroller. You know, they get out, they see the world, they can smell, they can get out and do some bits of exercise, but then they've got the option of getting back in and sort of having a rest. So it can break the walks down that little bit more for them. Mental stimulation is as important as physical. And, you know, I often hear people say, oh, you know, you can't teach Sighthound things. Oh, yes, you can. They have amazing noses and they can have a great time doing scent work as well. So thinking about emotional changes, chronic pain can change how a dog feels emotionally. So watch for those changes in behavior and be proactive about them, get them checked. This handsome dude, even though I do say so myself, was one of our lurchers. This was Alfie. He unfortunately got Cushing's disease and then got an unusual, unfortunately for him, muscle problem alongside it, which is why he has the wide stance that he does there. But being aware about chronic pain can be really tiring for them and can be change how they feel emotionally towards things and then make things easier for them. Weight is not always an issue for our Sighthounds, but it can be, and particularly post-neutering. Dogs who are overweight have more health and joint problems. A recent study has found that dogs who are overweight, it will typically shorten their lifespan by about 1.5 years. So obesity will shorten a dog's life. And fat is not just weight. Fat cells is an active cell and it secretes inflammatory hormones. And these inflammatory hormones can add to the osteoarthritis. Inflammation is never good, and it will put stress on many parts of the body, contributing to further diseases. So being aware of that. And if you do see the weight creeping on, and it can happen really slowly, actually just be aware of that and just, you know, cut things back a little bit. Because some of these problems are these more chronic issues, diabetes, the degeneration of joints, including osteoarthritis and heart disease, are all issues that can come with that excessive weight. So do keep an eye on it. And particularly if your dog gets an acute injury and your vet tells you to rest them, actually they may not need as many calories. So keep an eye on that, depending on how much rest they're having, because that can often be when sometimes that weight starts to creep on. And because we see our dogs day in, day out, we don't necessarily see these subtle changes, but they are there. And think sooner rather than later. So be proactive rather than reactive. And if you have a dog that's heading towards senior years or not, make some changes now. Make things easier for them, because if their physical life is easier, their behavioral life is easier as well. So some other things just for me to throw in there. Use a good joint supplement. The ones that have some studies behind them are the omega-3, but actually, you know, some of the other supplements have other additional things that can be beneficial. Boswellia extract has for many years been useful for inflammation. And observe your dogs, be aware of them, take photos, take videos, because the other thing there is you may forget what they looked like 6 months ago. But actually, if you've got a video of it, you can kind of go, oh, actually, yes, they're not putting as much weight on that leg. Or, you know, you're starting to see some of those little signals that indicates they may be a little bit concerned, maybe a little bit of lip licking. Find a good physical therapist of whatever sort. I'm a vet physio, but a massage therapist, McTimoney chiropractor. You know, we need a team for our dogs. A team keeps our dogs healthy, particularly as they're getting older. Make some of the simple changes mentioned today, even if you just make one. think about how much easier that makes things for your dog, and actually how much less stress that puts on the joints. And the other thing I was going to say is, if you've got videos, some dogs don't respond very well when they go to the vets. They shut down, they go inwards, they may shake. Your vet may struggle to see what you're seeing at home. So if you've got a video, you can go, look, this is what I'm seeing at home. Gives your vet a much clearer opportunity of going, oh, right, okay, yeah, I can see that, which actually your dog may not necessarily show when they go to the vet's office. So video can be a really useful tool, as well as slowing it down to watch it as well. So just a couple of things to mention about Sighthound behavior. And that thing, stop. I don't necessarily want to go any further. Some Sighthounds really struggle with the outside world. And one thing they may show this is they may freeze when they're out on a walk. It's one of the 5 Fs. So they go into that rigid, I'm not moving. And it may be that they've just seen something that startled them, or it may be that they've been out too long. And actually, it's really up to us to be aware of what's too long for them. Kai, the dog who I mentioned earlier, who had sleep startle, for him, sometimes 10 minutes was too long if the outside world was too busy. So being aware that your dog may be putting on the brakes and stopping for a good reason, have a look around, see what's changed in the environment. And if something's changed, give them a moment. And then sometimes something as simple as just giving them that moment, because the minute there's tension on the lead, they brace through the body. They actually can't move. Now, this is a picture of a mare who's a tripod, as you might have noticed. She fractured her left hock, and it was sadly too badly damaged to repair. She does very well as a tripod, but actually that does put a lot of strain on their other legs. So although they do really well, please be aware that that does put more strain on other parts of their body, and they may struggle, particularly as they age. One thing that we find can be really helpful for your dog if they do go into freeze and get a little bit stuck is actually, I'm just going to attach this to the collar just because he's not got a harness on, but actually just stroking the lead. So keep the end of the lead in one hand and actually bring one hand underneath, put your fingers underneath and your thumb on top, and just doing long, gentle strokes, and then inviting your dog to move forward. You may actually be able to encourage them to move around, but they will be stopping for a reason. And remember, your Sighthound is always just doing their best to have their needs met with the resources they have. And like I say, sometimes the outside world is a little bit scary, a little bit busy, and that may well be why they're stopping on the lead. One thing, again, that often comes up with our Sighthounds is because they are so narrow, they can back out of collars, harnesses, etc. This is Harrison in his harness. Rough wear do a harness also has 3 straps. And that back strap actually just means that if they do go backwards, actually that will not go forwards. But there's a clue. If your dog's going backwards, they're going backwards for a reason. And what is a natural opposition reflex for us is we tend to tighten the lead and stand still. Actually, if you can train yourself to step back with them and maybe stroke the lead, actually they will often stop sooner and come out of that panic. So think about the equipment that you're walking them in. It does also need to be comfortable. So think of it for safety reasons, but also think about those comfort reasons as well. because living with our sighthounds is fun. They are sweet-natured, and it really is a true honour to share their lives and ours. And this is Finn. Finn was our very first rescue lurcher 27 years ago. This was in his more senior years, and you can see that actually he has a coat change around his neck. What can often happen for our senior dogs is that because they use their front legs more, actually the coat, you get changes around the neck and possibly on the shoulders as well. It looks almost like a lion's mane in some cases because it stands up, it's in different directions. Actually, that's because they're using their body quite differently. And he was my first teacher. He sent me to Sheila Harper Canine Centre. He sent me on a path of learning about training and behaviour because he struggled with other dogs. And I wanted to find a way that really helped him. And one thing that I then found was actually T-Touch helped him even more, because actually what we have to consider is the emotional aspect of behaviour. You know, every behaviour has an underlying reason, and quite often the underlying reason is that feeling of safety and security. So I hope you've enjoyed that. I have realised how long I've gone on. I am terribly sorry. But I will stop sharing the screen now, and if anybody's got any questions, then I'm happy to answer those for you.
Fantastic stuff. Thank you so much, Rachel. And absolutely, yeah, just so much useful information. And I think for those of us who've had the time and been able to stay on, I think it's I could sit here all day and listen. I think it's fantastic, and I've certainly learned some really useful information from that. So really great. So thank you, everyone.
I could have gone on longer.
We'll get you back. We'll just get you back. It's all good. So thank you, everyone who's hung in there and stayed on. And some really interesting comments in the chat as well. Dr. Kuto had to leave us, our founder, but was having some really great chats with people. But just to say, if you are interested in the blood and the bleeding side of things, then do keep an eye on our social media, because Dr. Kuto will be speaking at our next webinar. Just coming back quickly to the comments that were not necessarily answered, and just picking up where you were talking about equipment and harnesses. Gretchen was asking about recommendations for harnesses. She runs with her dog, and she thinks a harness would be better for her for that. Sorry, I've caught you whilst you're drinking.
I couldn't mute while I was talking. And I'm thinking, gosh, my voice is going. So no, that's fine. Absolutely. I mean, it really depends where in the world you are as to harness recommendations. One thing I would say for any harness, I do like the fleecy lined ones for my sighthounds, just because they have such thin coats and such thin skin that actually I like them to have that additional comfort. The thing we often find with our sighthounds, and I really wish I could find a greyhound one of these, but actually it's quite hard to find them that fit, because they have such deep chests that the section that goes across here can be too big, but actually they need it here. The ideal shape is the Y-shaped harness, which is it has a Y at the front. When you look at it, it's that kind of shape. You need to make sure there's a bit of clearance behind the elbow, so that as they're moving, that they have enough room there for the elbow. As I say, I like the fleece lined ones. The perfect fit harnesses can be good because you can buy them in sections. So while somebody's just asked if they can see the picture again, can I just share the screen of the harness? Is that okay? Thank you. Let me just go back. I will have to work backwards, but bear with me. So this one, I actually had specially made. So you can find somebody who makes harnesses. So you can see this is fleecy line. It is a Y shape, so it gives good shoulder clearance, which is important because our sighthounds do have that long reach. And also, it was highly adjustable. So let me see if I can get the pointer up. Where is it? So this section's adjustable, the section underneath, and this here. And also this back bit as well. So this was made for Harrison, a lady in the UK called Hound Stuff. If I go back, this one that Amaya is wearing is a Y-shaped harness. Again, it's got the fleece at the front. We also like in T-Touch, and I've not had time to include this, which is a shame, but we also like harnesses that have a ring on the front, so that with a double-ended lead, you can have an attachment at the back and attachment at the front. And this often helps with balance and body awareness for them as well. So again, I had this made for her, just because they are difficult to find harnesses, but the perfect fit come in 3 different sections. The rough wear harnesses tend to be a good fit, depending on the shape of your sighthound. So that's another make that may also be helpful for you as well.
Fantastic. Okay, and then just another very quick question before we kind of finish up, really. Unless anyone has any other questions, do have a quick think. But again, I'm very conscious of timing. Just to ask, what constitutes a good warm-up? If you're going to let your dog off lead at the park, is a 10-minute walk beforehand, is that enough?
So yeah, 5-10 minutes. The important thing is that they've not been lying in the car for ages, and then all of a sudden get out and you've got that boom, because that's when you're going to get the injuries. I do have a warm-up routine that I created actually for some sports dogs. Walking on the lead is a really good start because it gets the blood flowing, it gets the muscles moving. Sometimes little figure of 8, so getting them to do sighthounds don't do little figures of 8 though. I mean, obviously their body's long, but actually getting them to do a few sort of figure of 8s, because then you're getting that flexion through the body as well. So yeah, lead walk for 5-10 minutes is a good start. A few figure of 8s. It also depends how they tend to be when they're off lead. You know, some of them do absolutely shoot off, and that's when you kind of, oh no, I don't want to watch, because it can be a little bit scary. But you know, if they're sniffers and moochers, I would suggest any breed of dog have a bit of a warm up before they just go shooting off. But particularly for our sighthounds, they have that explosion that actually, that's when you're going to get those muscle tears, those strains. And, you know, people think, oh, broken bones are a nightmare, but muscles take longer to heal. And with the scarring, you then get repetitive injuries. So if we can avoid them in any way, then yeah, on lead, 5-10 minutes, get them to do a few little bits, a few little S bends, even just getting them to do that movement will be really helpful.
Sorry, I can unmute. My mouse decided to stop working there for a second. Fantastic stuff. Thank you very much. And then, yeah, really just one final kind of comment really from Dr. Kuto, who said, you know, really interesting information about the osteoarthritis. In the US, the prevalence of osteoarthritis in greyhounds, other than in the hock and digits, is extremely low. And I think from our perspective in the British Isles, it's probably quite similar. And I think particularly with greyhounds, the issue is largely about stress
injuries.
Fractures. It's trauma based. Yeah, so greyhounds are naturally very resilient to osteoarthritis, but it's it's the fast running, it's the bumps and all the rest of the fun and games that they have.
It's the damage that they do. It's that damage.
But what's interesting, what's really, really interesting, sorry to interrupt the point that Dr. Kuto then went on to make, was that actually when you go to the vet, if your dog is showing hip pain, for most breeds, that would lead lots of vets to a presumptive diagnosis of osteoarthritis, and they would put the dog on non-steroidal anti-inflammatories.
Yeah.
And as it's hip osteoarthritis in greyhounds is pretty unheard of. But osteosarcoma, of course, is pretty common in the upper femur in greyhounds, but not in other breeds. And sadly, then they are treated with non-steroidals first to see if that makes a difference, which of course it won't if they've got osteosarcoma, before eventually going on to a diagnosis. So it's it's interesting. And that's where you need your vet to have that sighthound knowledge, really, that greyhound knowledge. But anyway, so thank you so much. Thank you everyone for coming, and thank you so much, Rachel, for an amazing, fascinating talk that, of course, is very holistic. You know, our animals, our dogs are one being. You know, that everything is going to impact everything else in terms of the body, behavior, emotions. So it's really important to take a holistic approach. Please do have a look at our social media for our next talk coming up. As I say, it's going to be Dr. Kuto, and details will be distributed over the coming weeks and months, and we'll keep you updated with what's happening. Over the coming days, we will pop up the recording onto our YouTube channel, which you can check out any of the webinars and things that you might have missed. And of course, we are a charity. We don't get any statutory funding, so if you would like to support us with a donation, big or small, it all helps our work, and we'd love to see you at a future event. So thank you very much for joining us.
Thanks very much for having me, and it's been lovely to have everybody here. So take care, everyone.
Take care, everyone.